Good morning, everyone. I'm Dr. Smriti Giri. Today, I'll be doing a presentation on Alzheimer's disease. This is the basic outline we'll be following for the presentation. And now let's begin with the definition of Alzheimer's disease. Alzheimer's disease is one of the most common cause of dementia. It's a neurodegenerative disease, and it is characterized by thinking, memory, judgment, and reasoning problems. It is a progressive disease. So, what is the functioning of normal healthy neurons? Neurons communicate with each other with the help of electrical signals and chemical signals. The informations are received by the dendrites as electrical impulses, and it is passed along the axons to the axonal terminals, like over here. And from there, the neurotransmitters help in transmitting of the impulses from the terminals to the neighboring neurons. In the synapses, there are numerous amyloid precursor proteins, which are usually cleaved by the alpha secretase to the soluble peptides. These soluble peptides remain in the extracellular space and cause no problems. But the pathology of the Alzheimer's disease is that the beta secretase, it causes the cleavage of the amyloid precursor protein into beta amyloids. These are insoluble peptides. These peptides gets collected in the synaptic clefts, thereby preventing the transmission of the electrical and the chemical impulses. This results in the lack of the communication between the neurons and the neuronal death, which is associated with the memory deficit, language problems, and atrophy of the brain as whole. So, what are the hallmarks of pathology? It is basically associated with deposition of various kind of toxins like amyloid plaques that I discussed in the previous slide. Deposition of beta amyloid proteins and tangles, which are the tau protein, is associated with the pathology of the Alzheimer's disease. In this image here, you can see these are the brown color deposition, which are amyloid plaques, and these are the neurofibrillary tangles. These plaques and tangles are deposited first in the hippocampus, which is associated with memory forming. Then the deposition begins in the language center, which is associated with deficit in the language, problems in remembering the words. And this deposition then spreads slowly by slowly from one part of the brain to another. And later, in the severe Alzheimer's disease, there is a global deposition of these toxins, and that is the main pathology of Alzheimer's disease. So, how can we classify Alzheimer's disease on the basis of onset? On the basis of onset, it is defined as early onset Alzheimer's disease and late onset Alzheimer's disease. Early onset Alzheimer's disease is usually seen between 30 to 65 years of age and is associated with mutation in the three basic kind of genes, especially the amyloid precursor protein, presylin 1 and 2. Amyloid precursor protein is located on chromosome number 21, which is also associated with Down syndrome. And this is the reason why patients with Down syndromes are seen suffering from Alzheimer's disease of early onset. Late onset Alzheimer's disease is the most common one. It is mainly seen in older people, and onset is usually in the mid 65 year of age. And the inheritance of the E4 allele of apolipoprotein E is associated with the late onset Alzheimer's disease. So, what are the diagnostic guidelines for the stages of Alzheimer's disease? It is usually defined as preclinical mild cognitive impairment and Alzheimer's disease. Preclinical, there is no apparent symptoms of Alzheimer's disease, there's no dementia, the person is completely healthy, but the deposition of amyloid has begun. It usually occurs more than 10 years before the actual onset of dementia in a patient, and it doesn't require any medical intervention and is just used for research purposes. Mild cognitive impairment, here there is the symptoms of memory and thinking, which is greater than in normal individual, but it does not interfere with the normal functioning of life or activities of daily living. People with mild cognitive impairment may or may not progress to Alzheimer's disease. And Alzheimer's dementia, it presents with the common pathological features of Alzheimer's disease, which are memory loss, word finding difficulties, and visual and spatial problems. So, why is Alzheimer's disease important? It is because the statistics shows that 5.5 million Americans have dementia caused by Alzheimer's disease, of which two-thirds population are women. So it is very important in the sense that women are mainly affected more by Alzheimer's disease than men. This number is expected to triple by 2050. It's the sixth leading cause of death in the United States, and one of three older Americans die of Alzheimer's disease or other dementia. Every new individual is diagnosed every 70 seconds, and it kills more people than breast cancer and prostate cancer combined. So, what are the risk factors for Alzheimer's disease? I have tried to classify it on the basis of modification, if it's modifiable or non modifiable. So, the non modifiable risk factors are age, everybody ages, there's no treatment for aging, and genetics. We are born with certain kind of genes in our bodies, and we cannot do anything about those kind of genes. And apoe gene, apoe2 is associated with decreased risk factor, and apoe4 is associated with increased risk. Modifiable risk factors are cardiovascular disease, hypertension, stroke, diabetes, and high cholesterol. Researchers have found that a person who is able to keep his heart functions healthy is able to keep his brain functions healthy. So anything that improves the heart function, like control of the diabetes, control of hypertension with medications, and anything helps in improving the brain function as a whole. So, what is the association of traumatic brain injury and Alzheimer's disease? It has been found that 30% of the patients who died of traumatic brain injury have amyloid beta plaques. Traumatic brain injury also initiates a chronic disease process of amyloid deposition in the brain. So, it is very important to monitor the people who have ever had traumatic brain injury in their life for Alzheimer's disease progression. So, what are the biomarkers for the diagnosis of Alzheimer's disease? There are various biomarkers, but the most important ones are MRI, PET, and CSF measurements. MRI, we can see the anatomic differences and changes in the brain of Alzheimer's disease patient. There is loss of tissue, there's atrophy of the brain, and there's neurodegeneration. PET scan is used to look for the level of glucose metabolism in the brain, and Alzheimer's disease is associated with the hypermetabolism of glucose, and that is one of the important findings in PET scan and is used for the diagnosis of Alzheimer's disease. Cerebrospinal fluid measures the presence of the amyloid beta 42 plaques and tau protein. These are found in the cerebrospinal fluid because of the shedding of these proteins from the brain. Here is a picture of an MRI of brain with Alzheimer's disease. This is the healthy control, and this is the patient with Alzheimer's disease. You can see there's atrophy of the brain as a whole. There's the narrowing of the gyrus and widening of the sulci, and there is the somewhat widening of the ventricles as well. The hippocampus is atrophied, as evident here. This is how a hippocampus should look like, but in Alzheimer's disease, it is atrophied. And F-fluorodeoxyglucose PET scan of patient with Alzheimer's disease. This is what it looks like. This is the brain of an Alzheimer's disease patient, which shows a decreased glucose metabolism. This is how a normal brains look like. Amyloid positron emission tomography, it estimates the beta amyloid neuritic plaque density. In this image here, you can see this is the brain of a normal healthy individual, and this is the brain of a person with Alzheimer's disease. You can see the increased amyloid deposit in a person with Alzheimer's disease, and there is no amyloid precursor or very little deposit in a normal person. So, what is the importance of biomarkers and what is its relationship to the clinical stages of Alzheimer's disease? As we discussed earlier, that Alzheimer's disease can be classified as preclinical, MCI, mild cognitive impairment, and dementia. In preclinical symptoms, we do not find any symptoms of Alzheimer's disease evident, but the cerebrospinal fluid can show the presence of amyloid beta and tau proteins. So, why is it important? It is important because if proper intervention can be done during this stage of disease progression, it is possible to delay the onset of actual dementia uh, in a person who is susceptible to developing Alzheimer's disease. So, this is the basic importance for the disease intervention. So, what are the steps to improve cognitive health in an individual? Alzheimer's disease is a kind of disease that has no regression. It progresses, and there is usually no treatment is effective in completely preventing or controlling Alzheimer's disease. So we need to focus on things that can improve the brain health as a whole. For the brain improvement, the number one thing that is important is regular exercise. I will explain to you in next slides why is it important. And healthy diet, Mediterranean, and the mind diet. Spending more time with family, socializing, having conversations, it improves the brain health. Keeping mind active with stimulating games, for example, Sudoku or chess, anything that improves the brain function. And control of diabetes, hypertension, and obesity, like I explained earlier, anything that's good for your heart is good for your brain. Avoid smoking and alcohol consumption and sleep well. It has been found that people who have insomnia are more likely to develop Alzheimer's disease. So, what is the neuroprotective effect of exercise on cognitive decline? It has been found that people who work out are less likely to take alcohol or smoke cigarettes, and exercise is associated with improved heart function by decreasing cholesterol, triglyceride, and exercise is also associated with decreased depression, anxiety, ADHD, etc. And it also improves the lifespan of animals, so definitely of humans also. So, what is the association of exercise and AD, this graph here shows that people who work out more than 3 times a day are likely to suffer from Alzheimer's in the later period of their life, usually in 80s. And people who do not work out or work out less than 3 times a week are likely to suffer Alzheimer's in their early 70s. And also you can see the disease progression is much more rapid in people who do not work out, and it's slower in people who do work out. So, what are the direct effects? So, exercise is associated with angiogenesis, synaptogenesis, and neurogenesis in the brain, and it is mediated by factors such as brain derived neurotrophic factors, insulin like growth factors, one, and hormones and second messengers. So there are certain diets which helps to improve the global functioning of the brain. Um, these include Mind Diet. Mind Diet consists of Mediterranean diet and DASH diet. As we all know, DASH diet is used for patients with hypertension to control their blood pressure. So these diets include leafy green vegetables, berries, whole grains. Fish is one of the most important factors that improve the brain function. Then there's poultry, beans, nuts, especially walnuts, and wine, olive oil. And there's this spice known as turmeric. It is widely used in South Asian cultures, and it is associated with improved brain function. So, what is the current treatment regimen for Alzheimer's disease? All stages of diseases are treated with donepezil. Mild to moderate Alzheimer's disease is treated with galantamine, rivastigmine, and moderate to severe is treated with memantine. Mild cognitive impairment does not require any treatment because not all MCI progress to Alzheimer's disease. So, it is very important to keep that thing in your mind before prescribing treatment to a patient with Alzheimer's disease, MCI. What is the summary? So, what we have learned from this presentation is that Alzheimer's is the most common cause of dementia, and it cannot be completely prevented or slowed down with medication. But certain lifestyle modification, for example, mind, diet, and exercise, can help improve the brain functions. Certain biomarkers can diagnose Alzheimer's disease in early stage, and early intervention is associated with a delayed progression or delayed onset of the disease. So for today's presentation, I used these references. You can check the informations from these references, and thank you all for listening and for paying attention. I had a great time. Thank you so much.